Hello, once again, I'm Dr. Mario Garita, and for those who don't know me, I'm in practice in San Jose, Costa Rica, and I specialize in dental implants, oral surgery, and full mouth rehabilitation. Yes, okay. Basically, the difference between dental restoration and full mouth rehabilitation is when you have a bad crown and needs to be changed, that's called dental restoration, which includes the removal of the crown and the fabrication of a new one, and everything will be just fine. But in most cases, what we find that most people have lost the function and aesthetics of the whole system itself, and it needs more than a dental restoration. That's what we call a full mouth rehabilitation that will include not only the restoration of every individual teeth, but it will also include the reestablishment of the function and the aesthetics of the whole system. In most cases, when we're talking about full mouth rehabilitation, it can either be full upper and lower new dentures, it could be implant supported dentures, it could be implant supported fixed bridges, it could be crowns and bridges supported by teeth, or it could be crowns and bridges supported by implants and teeth as a combination. You know, it varies a lot, but what's most important, it's the concept itself. In most cases, I'm not able only to replace or give you a good smile if I don't have the space available in order to work properly and to give you a consistent result for a long period of time. For example, I just had a patient this week that presented to me with some cavity lesions here and there, but shifted teeth. He had lost a couple of teeth over time. And after the exam, we determined that his vertical height, which is the height between his nose and his lower chin, was very short. And why was that happening? Because he didn't have any support with the back teeth. That left me no space in order to work his aesthetics or either to work on his function. So in order to reestablish that, I need to open up his vertical height. How? We need to work on his posterior support. We need to do some implants in the upper back and the lower back. And then with those implants placed in there, we can do a good height type of crowns back there that will support the bite, and then we can rebuild the aesthetic portion of his interior mouth. That's a very interesting question, because TMJ, it's not a disease itself. It's a symptom that a patient develops over time because they have lost vertical dimension, they have lost support of their bite, and we need to reestablish those things first in order to give a good position to the balance between the skull and the jaw through the articulation, so that the ligaments and cartilage can start working normally again. Well, the symptoms of TMJ issues vary a lot. You know, we've heard of clicking, popping, granules, like if you had sand near your ear, like when a shell of the egg breaks and stuff like that. Most cases are like that. There are others that are more symptomatic, more pain related. Some of them just lock their jaws in position, and it can get worse and worse. The ideal is not to get to those points. The idea would be to catch the diagnosis at a good time and reestablish your mouth height and the function properly so that we can avoid those problems in the later run. The new way of treating missing teeth, it's definitely dental implants. That's the most predictable and long-lasting way of restoring missing tooth, or many missing teeth in whatever case. There are two ways: the classic two-stage protocol and the immediate loading type of protocol. Many people get confused on it, and they try to force me to do the immediate load, and maybe they are not candidates. The safest way is to follow the two-stage protocol, in which we place the implant first, we let it heal, and posteriorly we will fabricate the crowns that go in top of it. That's the best way to do it because we let the implant heal, osseointegrate inside the bone, and that way we can assure you that everything is nice and healed and ready to go and problemless. The other option is the immediate loading protocol. Not many people are a candidate for this protocol because we need good quality bone, good health, and we need good quality gums around it. We need to design the case in a different way. We need to add, in most cases, more quantity of implants, and there's always a doubt that one implant can fail or not. So not everybody is a candidate for the immediate loading protocol, and it's not one of my favorites. I prefer to go the safe way. That way you will have a good long-lasting result for a long period of time. I want to talk to you about 2 myths that I have heard in implant dentistry. They are very, very important for you to have them clear. One of them is, doctor, if I have a tooth pulled, do I need to do the bone graft and then come back to get the implant placed? Well, no. I have been doing it for over 20 years. When I take a tooth out, it's the best time to put the implant in and the bone graft at the same time. When you take a tooth out, there's a lot of healing factors that are liberated from your tissue, from your bone, from your gums that help the healing process in a natural way. So by taking the tooth out, putting the implant and doing a bone graft, it's a completely normal process and it heals beautiful. That's something you have to understand. There's no need to wait. And also when we do sinus bone grafts, I like to do my bone graft and I like to put my implants at the same time. The implants will support the bone graft in a better way, will give it more stability, and you will have a much better and faster result. In general, those are 2 myths that I don't agree with, and I want you to understand the reality of things. When you come to our office, the most important part is when we do the diagnosis and the best treatment option for you. When we have agreed on that, we can be sure that we're going to be providing the best possible treatment for you. To do our diagnosis, it's important that we use the 3D tomography imaging. That's the newest technology available to see by the millimeter how we can improve your full mouth rehabilitation and improve your dental health, which is the most important thing here. Through the tomography imaging, we're able to pinpoint every little thing you can imagine based on your teeth, your bone health, your sinuses, where your nerves are. We can determine everything, and we can average every single aspect of it without leaving anything behind. Things that we weren't able to see before, there's no reason why not to see them now. And that's very important when you come to a dentist. You have to make sure that things are done the right way. And to close this off, I just want to remind you, I'm Dr. Mario Garita. I'm a specialist in implant dentistry, oral surgery at University of Miami School of Medicine. I have been in practice for over 22 years and I have a state-of-the-art facility here waiting for you. I can assure you that through our proper diagnosis, we will determine your best treatment option and we will be giving you the highest quality dental service that you can expect anywhere in the world. And you will be saving at least 50%. I can assure you that, and just give us a chance and I'm sure that you will be completely satisfied. We'll be waiting for you.